So one of the most common ways that we see impingement or issues within the hip is in the internal rotation. And internal rotation would be when we do this, right? A lot of people will get some pinching across the hip, and sometimes it's more of a joint issue than it is a muscle or a tendon or a ligament issue. It can also be some of the ligaments that are tied up around the actual hip joint, but a lot of people don't have the mobility within the hip joint itself. So what we're going to do is show you an exercise that will do that. So with the banded hip here, or banded hip distraction, we're going to pull this deep within our groin, right? And I'm going to show you actually on this side so you guys can see a little easier. We're going to pull this high up on the groin, just like we've shown you in the past, and we're going to toe walk, or shoulder walk I should say, and we're going to let the band do the work going downward. Now in this position we will grab a stick, a pole, a baseball bat, whatever you have at home, and we're going to hook on the outside, and then we're going to hook it on the heel. So right, you can see how we hook it on the heel here, and what we're going to do is we're going to drive that internal rotation. We might support a little bit at the knee and hip here, and then come back. Drive the stick this direction, be careful on the knee, and just mobilizing back and forth. It's not about how far you can get, it's really more about getting the joint to move freely, and then repeating maybe 5 reps, maybe 10 reps, while it's in that distracted position. Now, if you're also in this position, you may want to do the opposite, where we put the stick on the inside and hook the rotation, the heel on this side, and we might frame here and do some external rotation, right? So that's external rotation of the hip, and then on the inside we have framing here, internal rotation of that hip. Remember, it's about getting the joint to move freely, and it's not about forcing this type of motion. It's about getting that hip joint to move and slowly increase its mobilization through the joint, and not trying to force it, because this is a joint mobilization, not a muscle, okay?